Please join us while we take you on your journey to an active, pain-free lifestyle after total knee replacement surgery. This presentation will help you in understanding the fundamentals of total knee replacement surgery. It is an educational tool designed to answer some of the questions you may have. Thanks to all of the recent advances in total knee replacement surgery and our patient and family-centered care approach, we will make your recovery as anxiety-free, pain-free, and as rapid as possible for you and your family. Total knee replacement surgery is one of the most successful procedures in all of medicine. There is an increasing need for total knee replacement surgery as baby boomers age because the incidence of problems increases with age. Osteoarthritis alone disables approximately 10% of Americans aged 60 and over and compromises the quality of life of more than 20 million people. So why live in pain due to knee arthritis? Let's begin with an overview of the knee. The picture you see is of a normal knee joint. There are 3 compartments or parts of every knee. The knee consists of the femur or thigh bone, the tibia or shin bone, and the patella or kneecap. There is also cartilage, which is the precious material that covers the ends of bones and allows the joints to glide with virtually no friction. Notice that there is a gap between the femur and the tibia, which indicates the presence of cartilage. As you can see from the picture, cartilage creates the soft surface between the femur, tibia, and the kneecap. It acts to cushion the weight-bearing surfaces of the knee. When arthritis sets in, the cartilage between your joints begins to wear over time, and eventually the bone wears down too. This causes the inflammation and pain, which prevents you from maintaining your active lifestyle. Here is an example of the x-rays of a normal knee. As you can see, there are normal spaces between the femur and the tibia, which are filled with cartilage. These are the x-rays of an arthritic knee, which show that the cartilage has completely worn away and there is raw bone rubbing on raw bone. This is what causes the intense pain and swelling associated with arthritis. As you can see from these x-rays, the gap between the tibia and the femur is completely gone. We prefer these x-rays be taken standing with the knee slightly bent, so the knees are shown in a weight-bearing position as they normally would be while you are walking or standing. This allows the physician to determine the amount of cartilage remaining between the bones. The first question you may have is, what is total knee replacement surgery? The term is often misleading. It gives the impression that the entire knee is actually removed. In reality, all that happens during total knee replacement surgery is the tibia and femur are resurfaced to remove the arthritis, and the missing cartilage between the tibia and the femur is replaced with an artificial polyethylene cartilage. Think about the last time the tread wore away on your automobile tires. You didn't need to have the whole wheel replaced, but rather only the tires. In essence, a total knee replacement surgery is joint resurfacing of the ends of the tibia, femur, and undersurface of the kneecap. Think of total knee replacement surgery as a knee cartilage replacement. During surgery, the kneecap is slid out of place and the ends of the tibia and femur are resurfaced to fit the prosthesis. The prosthesis consists of chrome cobalt over the resurfaced femur and titanium over the resurfaced tibia. An artificial polyethylene cartilage is then fitted between the femur and the tibia, and a polyethylene button is placed on the undersurface of the kneecap. Once the 3 parts are in place, the metal rubs on the plastic instead of the bone rubbing on bone, alleviating your pain and allowing you to resume your normal active lifestyle. Our patient and family-centered care approach is unique in that it focuses on the needs of patients and their families. For instance, before your total knee replacement surgery, we require that you have a history and physical, blood work, and special testing to make sure your health is in tip-top shape. The great thing about our program is that patients are able to have all of their pre-testing done in one place in less than 2 hours of their time. We refer to this as one-stop shop. Testing day is your test day for you and your coach. During your one-stop shop, you will have a history and physical examination, lab work, EKG, urinalysis, and chest x-ray. We will also address any questions or concerns you may have if they are not already answered as we go through the whole process of a total knee replacement surgery, start to finish. Here at Renaissance Orthopedics, we have a special approach to total knee replacement surgery to make this experience as pleasant and anxiety-free as possible. We call our approach the Patient and Family-Centered Care Approach. Patients choose to have total knee replacement surgery in order to regain a higher quality of life, but remember, surgery is only one part of a much larger process. The Patient and Family-Centered Care Approach is designed to make the process as easy and pain-free as possible for patients and their families. We promote a positive experience and a successful outcome with our complete approach. In summary, we believe that the Patient and Family-Centered Care Approach involves education and preparation, a less invasive surgical technique, special anesthesia and post-op pain management protocols, rapid rehab, and even minimal waiting because we value your time. We like to think of our special program as a hospital within a hospital. We have designed our own floor, which is tailored to meet the needs of total joint replacement patients. Even the physical therapy unit is on the same floor for your convenience. We also provide a spacious family area with refreshments and a massage chair. Patients even have room service available 24 hours a day. We strive to understand patients' needs from beginning to end with our team approach and focus on wellness. We make the process of total knee replacement surgery as pain-free and anxiety-free as possible. Due to our focus on wellness, patients are encouraged to get dressed in their exercise clothes daily. Our team encourages a wellness approach to recovery. One of the aspects of our program which makes it special is our rapid rehab protocols. During your hospital stay, you will take part in aggressive therapy twice a day, starting the night of surgery. Keep in mind, progress varies from person to person and largely depends on your effort. This is why it is important to work hard in physical therapy. You will be taught several exercises which will help in the recovery process. You even use a CPM, or continuous passive motion, which bends your knee for you to improve your motion. You also get to bring your CPM home with you to use. Once you are discharged to home, a physical therapist will come to your house every day for therapy. You will then start attending outpatient therapy. Remember, the speed of your recovery is up to you. The purpose of total knee replacement surgery is to get patients back to normal activities as soon as possible, and through hard work and a positive attitude, you will be on the quick road to recovery. Here are some general guidelines for you and your family, which will help you get a better idea of what to expect after surgery. Our length of stay in the hospital is only between 1 to 3 days because you are full weight bearing the day of your surgery. In addition, 96% of patients are discharged directly to home with daily home therapy. Very few patients are transferred to a rehab facility because there are no restrictions from our standpoint. The only activity we tell patients not to do is jogging for exercise or other high-impact activities, as they cause accelerated wear on the knee. Otherwise, patients are able to get back to full activities when they feel comfortable. Because patients work so hard in therapy while in the hospital, we have arranged for relaxation time too. Enjoy a relaxing massage prior to discharge, compliments of the orthopedic program. We also have a massage chair in the family room for family members to use at no charge. What is it about the craze for minimally invasive total knee replacement surgery? The term minimally invasive is often misleading, as it would be more accurate to describe the procedure as a less invasive approach. Basically, surgeons are using smaller incisions and less invasive techniques. But it is important to remember that the surgery itself is just one component of a successful total knee replacement surgery. Here at Renaissance Orthopedics, we feel that the patient and family-centered care approach is what makes our program special. Patient and family-centered care, education and preparation, special anesthesia and post-op pain management protocols, and rapid rehab all contribute to making your total knee replacement surgery experience as easy and pain-free as possible. In the orthopedic program, you and your coach become part of a dedicated team whose goal is to ensure you achieve the best possible results. By working together, we can have you walking the day of surgery, driving when you're on a cane, and back on the golf course. So overall, we found that we need a complete approach in order to speed your recovery and get you back to your active lifestyle as soon as possible. As with any surgery, there are potential adverse effects. Keep in mind the adverse effects are very rare and can be associated with any surgery. These include, but are not limited to, infection, bleeding, blood clots, heart or lung problems, nerve injury or blood vessel injury, fractures, and stiffness. As part of the education process, we would like to inform you of what to expect after your total knee replacement surgery. Often patients have swelling and bruising around the knee and lower leg for up to 8 weeks after surgery. Furthermore, clicking without pain is normal and occurs in 50% of patients, and you can even have warmth in the knee for up to 1 year following surgery. This is the body's tissue reacting to the implant and evidence of the healing process. Please do not hesitate to contact us if you have any concerns or questions after the surgery. Since you have decided to proceed with total knee replacement surgery, we would like to emphasize the importance of developing a therapeutic partnership between you and the doctor. The surgical outcome depends not only on the surgery itself, but also on your participation and the ability of your body to heal itself. We will work through any unexpected outcomes or issues together, but it is important to remember that there can be unexpected outcomes with any surgery. As you go through this experience, please feel free to share with us your feelings about the process. Remember, we will be there with you every step of the way to full recovery. We hope that this presentation has helped to give you a better understanding of both total knee replacement surgery and our special program. We will be happy to address any further questions or concerns you may have. You will also be provided with an educational folder which will address many of your questions. Thank you, and the best of luck to you on your journey to an active and pain-free lifestyle.